In this video, we're going to talk about who has what authorities during an emergency. Now, ideally, you would have your the NIM system set up. You'd have your incident command system set up, but who and at what level agency can actually declare that to be put in place and actually activate those systems? So, who has authority during an emergency situation? Now, any emergency, regardless of what it is inherently a local problem. It's the town, the city that's being impacted. And the local officials, the people who are on the ground, who know the community members who live in those neighborhoods, are inherently in a better position to know the population and what the population is going to do. But oftentimes, emergencies go across these boundaries because political boundaries are essentially arbitrary. So you need large-scale coordination to have an efficient response when multiple communities or multiple states are being impacted. And there are several authorities which may claim control, but they don't always have control. So the federal government may come in if multiple states are impacted. This is through FEMA, the Federal Emergency Management Agency. State governments can come in, will try to come in if multiple cities and towns are impacted in their one state. This can be a public health agency, this can be an environmental and emergency response agency, or some other public safety agency, so police, fire, or emergency medicine, or even the local government, because again, we'll try to take control, because again, emergencies are inherently a local problem. But constitutionally, there is actually an answer for this and who does have primary authority over an emergency situation. So this goes back to the U.S. government's institution of the idea of federalism. And federalism is a form of government where there's a division of power between the federal and regional governments. And in this case, the regional government is our states. So there's a very explicit division of power between what the federal government can do and what the state government of Rhode Island can do. And what the Constitution does is it directly specifies all of the powers given to the federal government. It says the federal government can do X, Y, and Z. It can tax, it can spend, it can approve nominations, things like that. It's very limited in that respect because if it's not said in the Constitution, the federal government can't actually do it. And all of those powers which are not expressly given to the federal government are reserved for the states. Now, when the Constitution was written, the idea of emergency preparedness and public health really wasn't a thing. So there's no constitutional line in there giving the federal government the right to be the authoritative, to assume an authoritative role in an emergency response situation. And because all of the powers not given to the federal government in the Constitution are reserved for the states, the authority in an emergency ultimately rests at the state level. It's not the local level, it's not the federal government. It ultimately rests at the state level to use the NIMS and to create incident command systems. That doesn't mean the federal government won't try. It doesn't mean FEMA or another federal agency will try to come into a situation and take over. But ultimately, FEMA and the federal government does not have a right to address any particular emergency. When they do address emergency and become that lead person, that lead authority, the states are expressly giving up their authority. They're ceding authority during that emergency time. So during a hurricane, a state will cede authority to FEMA because they think FEMA can mount a better response. They don't have to, but they can if they choose to. If states act alone and don't work with nearby states or don't give up authority to the federal government, this can actually have a very negative impact in the responses to an emergency. Different states may do different things. The resources needed to effectively respond to an emergency may not be in place. The logistics required to move resources from one location to another may not be in place. Particularly here in New England, we have very small states. It may not be feasible to stage equipment and resources in our state because it's so small, all of it may be impacted by a major disaster, for a hurricane, for instance. Those logistics and resources may need to be placed outside of the state in a safe area so they're not actually damaged before coming in. So to have a coordinated response that's impacting large geographic areas, states either need to have a plan in place to coordinate across states and to use shared resources, or they need to have a plan in place to give up their authority to respond to the emergency and have FEMA or another federal agency come in and be that authoritative voice. What governments can do, whether local, state, or federal agencies can do during an emergency situation, is specified in a number of different laws, both at the federal and at the state level. And these can be very specific or very broad. So each state has some law saying that if the governor declares a public health emergency, typically the commissioner or the secretary or the head of the state public health department is in charge of that emergency response. But many of these laws are extraordinarily out of date. You're talking about laws that could have been implemented in the early 1900s or even the late 1800s that are trying to be applied to 21st century problems. And there are a lot of issues with that. The diseases and the emergencies that were thought of when those laws were put in place are unlikely to be represented now. Even if you think of infectious diseases, which were very prominent when these emergency laws were put in place, how diseases spread now is much different than they did in the past. We're much more confined. We have more people in more denser locations in our cities. We can travel easier, so diseases can spread from state to state, country to country, much faster than they could to a century or more ago. So we really do need to have a systematic updating of these emergency response laws. A model law, not a real law, but a hypothetical law that would address all of these concerns was created. It's known as the Model State Emergency Health Powers Act, and it includes updated ways to detect and track public health emergencies, defines how to declare a public health emergency, which isn't necessarily in current state law, gives special powers to public health authorities during emergencies, and these special powers are really quite expansive at times. This can be anything from requiring people to use their homes as staging grounds for emergency services, taking over different resources in different cities and communities to use for public health services, as well as basically enlisting people in the field to do public health work. But it also does on the other side. It's not just what government can do, but it also has updated powers in terms of protecting individuals and making sure that states just can't quarantine and put everybody in lockdown that they think might be sick or that might be in danger. It also has provisions to ensure that accurate information is disseminated to those communities and those neighborhoods who are particularly affected by a public health emergency. And a public health emergency can be pretty much anything. It can be a natural disaster. It can be a man-made disaster that we've kind of referenced a little more in terms of talking about emergency preparedness, but it can also be infectious diseases. It can also be chronic diseases. There's current talk about declaring a public health emergency for the opioid crisis. So it can be addictions that can lead to a public health emergency as well. And we need these laws to prepare for the future. Again, the public health emergencies that we're dealing with now are not necessarily the same as we dealt with 50 years ago, 100 years ago. And even when they are similar, the spread of disease can be much different now. It can actually be much faster now than it did in the past because populations can move a lot quicker and interact with more people than they could a century ago. So we worry about things and we need to prepare for things such as bioterrorism. What happens when if anthrax is released into the environment or into large population centers? What happens if someone has a storage of smallpox and that gets back in the environment, a disease which we've eradicated and there are very, very few individuals who have protection against? Or maybe someone figures out somehow to weaponize Ebola. Imagine if there was a weaponized Ebola, how would we respond to it? And what powers do we have to respond to it? These are all things that updated public health laws and public health emergency preparedness laws can help us deal with. Some things that are, not that bioterrorism isn't realistic, but things that are more probable is pandemic influenza. There's new strains of flu, particularly from birds, that seem to cause human cases of flu more and more each year. There's a new strain I read about known as H5N7. It not only seems to be able to jump from birds to humans, but it may even have human-to-human transmission, so it may have that capability. So that may be the next pandemic strain of influenza. And we also have to worry about cyber attacks and how our information is secure. That can be a public health emergency when it involves, protected health information, when it involves other information that can be used to steal our identities. And as we talk more about our emergency medical record systems, as we talk about more integration across the country so that the same information can be used anywhere that we're located, we need to know who potentially has access to that information and how is it being protected and how is it being encrypted so that even if it is released and someone can access it, it's still ultimately protected and can't be used against us.